Hello, my name is Anne-Marie Brown, and I am the current Vice President for Nursing for WIFPICS, the World Federation of Pediatric Intensive and Critical Care Societies. It has also been my honor to be one of the co-chairs of this first annual World Picu Awareness Week. Luca Tortorolo, who is my co-chair, will also wrap up our introductions this morning. We hope that you have enjoyed this opportunity to begin to learn a little bit about the nature of pediatric critical care from different regions of the world and from different disciplines that participate in the care of infants and children. You will also hear a welcome and response from our current PICU leaders, Dr. Satoshi Nakagawa, our president, and Dr. Brenda Morrow, our president-elect. And with that, I hand you over to Dr. Nakagawa.
Emily, thank you for your kind introduction. I'm Satoshi Nakagawa. I'm currently the president of the World Federation of Pediatric Intensive and Critical Care Societies. Welcome to your work today, the last day of the PQ Awareness Week. We are very happy to have you to join this session. This is the true multidisciplinary celebration. We have physicians, nurses, and the physiotherapists, as well as the pharmacists and other healthcare workers to join to communicate each other and to strengthen the ties among us. And this is a very good opportunity to show our activity to the other field of the people. And I would like to congratulate everyone for joining in this very special session. Thank you. I'd like to introduce Brenda Morrow. She's the president-elect of our federation. Brenda.
Thanks, Satoshi, Anne-Marie, and Luca. Yes, so I'm Brenda Morrow, and I am the president-elect of WIFPICS, as Satoshi mentioned. I'm also a professor in the Department of Pediatrics based in Cape Town in South Africa. And maybe most importantly, I'm a physiotherapist by training with many years of passionate experience clinically and in research in the PICU. And with that, I'm so excited to have been part of this wonderful World PICU Awareness Week in 2021. It's really been a fantastic week, I think, of global and regional interdisciplinary activity, focusing on raising awareness of topical issues and advocating for improved critical care services across the world. And as a physiotherapist, I'm especially excited to see all the interdisciplinary input from nurses, doctors, allied health professionals from around the world, because we know that it's only through a dedicated team that we can really give the best possible care to our critically ill and injured children. So thank you for being part of this, and I look forward to what the rest of the day has to offer. Thanks, Anne-Marie.
Hi, this is Luca from the space station, where Anne-Marie sent me to check and coordinate with her all the PQ week we had. And I think I will remain until the next year in May, when we start the new PQ week. In the normal day, I am a pediatric intensivist working at the ICU of University Hospital Gemelli in Rome, Italy. And I'm also a professor of pediatrics. I want to tell you that it's almost 30 years I was in a PQ. And since when I entered for the first time, it opened my mind, because it's really a world of things, a world of person, a world of resource, a world of things of doing. So different professionals, different persons, different problems. But then it's only 2 years I am in the World Federation, 3 years in the World Federation, and open again my mind, because I will face Picu from different parts of the world. So it's a word in the world. And that's rule that Anne-Marie gave me to send me on the space station up here, give me more an idea that the world is very different, but the difference is the power of Picu, is the power of World Federation, and we hope that the Picu week is going to be something that they make difference and make difference a resource for everyone. And the key word is going to be listening to others. So we are not so allowed to listen. And in this week, we listen different part of the world, different people, different problems, different professionals. So difference is our word. Thanks.
Hi, everyone. Luca and I are here live now after that introduction with our colleagues. And we just wanted to welcome you to the final day, the global day of our inaugural World Picu Awareness Week. I will reflect on the last thing that Luca said, which was, I have learned so much this week. I'm so grateful for our colleagues who put all the time and effort in difficult and challenging times to bring this to fruition. And today, what it's going to look like is we have 3 short videos to share. At the beginning of each one, coming up next is you will see a poll, a couple of survey questions that we'd like each of you to answer. And then we're going to show you the results, asking some questions about how the Picu works for you wherever you're at. And then we will watch the video that addresses some of the same issues. And then we'll talk a little bit about your experiences versus what your colleagues had to say from around the world in the video. And then we'll do the same thing. We'll stop, answer another couple survey questions, and watch that video, and then the same thing for the third video. Anything to add to that, Luca?
No, I just thanks you that you allow me to come back on the earth. This is the shuttle that let me get again on the ground. And I'm very curious how will be the survey, and at the end we will have the discussion.
Sounds good. We're ready for the first set of questions. You should be able to click right on the answers. As soon as everyone's had a chance to make their selections, we will show you our results. So here, you should now be able to see the results. And The overwhelming majority, 96%, says that your PICU does teach new PICU team members. And who do they teach? You were to select everybody that your team teaches. The majority teach physicians and nurses. About 22% say they teach pharmacists. 30% teach nutrition or dietitians. About 36% teach rehab team members. 28% respiratory therapists, and then 16% said they teach other people, other professions besides those listed. So with that, let's learn a little bit more about what your colleagues around the world have to say. Don't forget to unmute yourself for the video, please, Evelyn. There we go.
To acknowledge our tangata whenua, I'd like to open with a karakia. Whakataka te hau ki te uru, whakataka te hau ki te tonga, kia mā kina kina ke uta, kia mā tara tara ki tai, e hi ahi ane te arakura, he tio, he huka, he hauhau, tihei, Māori ora. There are a number of changes that will have a lasting impact on multidisciplinary PICU care. As mortality decreases, the focus has changed from optimising life for PICU survivors and looking at more holistic long-term outcomes from ICU care. We have a greater number of complex patients requiring long-term technical support, which requires very high level of multidisciplinary support. Our PICU patients are growing up and we'll need to work out how to effectively transition them. Our communities have greater expectations of PICU care. This is combined with higher acuity in patient numbers. These changes require a cohesive, multidisciplinary team approach where we all work to our strengths as equal partners to provide the best care.
COVID has certainly changed the landscape of hospitals and parental presence and visitors. But what hasn't changed, and hopefully will never change, is the need for compassionate and caring caregivers and team members. During, I would say, the most scariest admission we've ever had to critical care was at a time when she was suffering ARDS. And they were pulling out all the stops, all the last resorts. And I remember specifically it was Mother's Day and the prognosis looked very grim. And it was very scary to be there and be surrounded by machinery and by equipment that was all doing the job of saving her life, but also seeing all the other families struggle and children struggle and codes being called. It was a lot to take in. And on that day in particular, I was quite emotional, as you can imagine. And the doctor popped his head in and he asked if there was anything he could do. And through tears, I just told him I needed him to save Nikki's life. And I knew that they were already doing everything that they could, as were the machines attached to her. And so he pulled up a chair and sat beside me at her bedside. And we sat there in silence for about 20 minutes. He didn't rush off. He was just present. He wasn't doing, he was just being. And he was present with me. And I felt great support in that.
The fact that we are currently in the process of switching to a paperless system will most definitely have a lasting impact on our multidisciplinary PICU care. This is especially beneficial to our younger generation of nurses who are technologically orientated and who are our future nurse leaders within our critical care setting. As we all know, that the pediatric intensive care environment can be very daunting and it comes with its own stresses. Technology are taking over the world and healthcare systems are not excluded.
A crisis like the one we are facing with COVID pandemic requires quick thinking to face the uncertainty. Therefore, we need to have a multidisciplinary approach to ensure we're able to forecast and prepare for the futures, ensure the authority met the expectation with patients' care. One of the main challenges of the unit, how to enhance the environment to maintain staff resiliency and reduce work stress-related issues. We're working as a multidisciplinary approach to have a better well-being for the staff and for the environment, which has helped us as one team to overcome new challenges during the pandemic crisis.
The developing countries are witnessing a rapid growth of subspecialty programs in pediatrics. We are empowering our nurses to get involved in patient care, decision-making, and nurse education. So the two things which will have a long-lasting impact in Picu care are the involvement and training of nurses and also the development of Picus in smaller or tier 2 cities.
Right now, we're focusing on sample data and of the board.
Creo que uno de los desafíos más grandes y cambios más importantes que se ha evidenciado en general en las áreas clínicas pediátricas en los últimos años es integrar en el equipo de trabajo una mayor cantidad de profesionales especialistas en áreas clínicas. Y justamente ese cambio, uno de los más fuertes, uno de los puntos más fuertes que hemos experimentado en nuestro equipo. La inclusión de equipos fuertes de trabajo multidisciplinario, médicos especialistas, enfermeras en áreas críticas pediátricas, kinesiólogos, terapistas respiratorios en áreas críticas pediátricas, nutricionistas especialistas en el área y técnicos paramédicos que forman parte del equipo de atención continua durante 24 horas para nuestros pacientes, han permitido optimizar de manera directa las metas institucionales, con beneficios que son directos para cada uno de ellos.
At the Children's Intensive Care Unit in KK Women's and Children's Hospital Singapore, we look forward to a new exciting journey towards early mobilization in pediatric patients requiring intensive care. We're just starting out and have developed guidelines to help the team in assessing, executing, and evaluating the outcomes of our effort in early mobilization. Studies have shown the debilitating effect of a PICU admission and the potential for positive outcome of early mobilization. This initiative can only be achieved with excellent collaboration amongst the multidisciplinary PICU team members, and we look forward to walking our very first patient.
In my PICU, probably there are two main changes that are going on at this very time, at this very moment. The first one is that we are moving our PICU in another building, another unit, which is bigger and which is new and which is very interesting because it's full of colors, the background of all the walls. It's an aquarium with all the fishes, and so it will be a great improvement for my PICU. And the second thing that we are doing that probably will change and will improve the care of our patients is we are carrying on a new cycle of teachings. We have been doing this for the last probably 6 to 12 months approximately, which is a weekly teaching involving all the fellows and the registrars working in our ICU. And it's really improving the level of care of our patients because it's improving, it's stimulating us and all the fellows and also all the teams involved in the care of patients in the studying and being up to date with all the new guidelines.
I'm very excited to be a part of this awareness week. And the first question is what is changing now in the Pizza ICU? So before making this video, I consulted with some of my other colleagues that are working in pediatric critical care settings, so that this, when I make this video, it would be representative of the picture in my country. This is because of some of the limitations and resources we have, which I will talk about later in the video. But I consulted, and the general picture is that what is changing in the PICU practice in Uganda is that with regard that will have an impact on multidisciplinary approach in the PICU is that training is improving. Training of different specialties or specializations in pediatric critical care, training programs for different pediatric specialists are being opened here in Uganda.
El avance de los conocimientos científicos y las posibilidades de mejora en la tecnología biomédica han facilitado en los últimos años la profundización en el diagnóstico y el tratamiento de las enfermedades que afectan a los niños y los adolescentes en las unidades de cuidado intensivo. La participación de un grupo multidisciplinario en el cuidado del niño permite tener una mirada holística de las necesidades de este ser humano. El cuidado ahora no se centra en atender una patología, sino en atender un ser humano en desarrollo. La atención centrada en el paciente y la familia tendrá un impacto duradero.
Helping siblings to cope with seeing their sibling for the last time as they say goodbye in the critical care unit. Other times it's working slowly with a patient where they're at after an accident or an injury that has debilitated them and they have to relearn how to walk or talk or move. And my goal is always to bring some fun and some lightness, but always to speak the truth in a developmentally appropriate way that allows kids to thrive in environments that could be very challenging for them. Last several years, there has been more consideration of increasing the multidisciplinary team and really maximizing everyone's effect. So obviously when everyone works together, the patient and family get the very best experience. And I think it's just going to continue to grow and thrive. There's lots of research on the benefits of working together and including developmental needs, family-centered care, and all of those aspects. I think as we learn how to be better teammates, we also learn to show up kind of as our best selves, but also to promote that healing and coping together. So I think the way forward looks bright. And that there's lots of learning ahead for everyone. And I think more and more research continues to demonstrate the importance of multidisciplinary therapy into overall good quality care.
Changing now in ICU is 3 out of the 5 existing pediatric intensivists, which is quite a big change. And also we have lost many experienced PICU trained nursing staff, which will impact hugely on our multidisciplinary team.
One of the most important changes in our PICU is including different medical specialties doing round to discuss the patient situation and to come up with the most applicable and the best medical decisions.
As a pediatric respiratory therapist, the most lasting impact in our multidisciplinary Picu care would be the practice of new normal policies or protocols in delivering aerosol generating procedures, namely nebulization, CPT, suctioning, intubation, and the use of vital filters, non-invasive ventilation, such as your bag valve mask, your high flow systems, your CPAP, and your BiPAP, including the use of aerosol boxes to mitigate the spread of infection during delivery of these procedures.
So when I think about what's changing now in our PICU that will have the most lasting impact going forward, I really can't ignore the fact that we are all living in a pandemic that's changed so many aspects of our day-to-day lives, and particularly our lives at work. So for me, as well as all the challenges, the biggest positive change I truly hope won't go away were the amazing collaborations that we all owe to COVID. Over the past year or so, we have learned to work with each other, we've learned to learn from each other and to educate each other in ways that we wouldn't have dreamt of before. And this is regardless of the distance or ability to travel.
just think, I'm recording this piece today on Zoom. Most of us, certainly, I hadn't heard of Zoom before 2020. But this ability to connect remotely really brought us all together. And I almost think of it now as practicing medicine or practicing pediatric intensive care without borders.
So, after hearing from your colleagues about what some of the biggest challenges facing your PICUs and what lasting impact it will have, we'd like to ask you, is it the same for you? Or are your biggest challenges and changes different? And you can either respond in the chat to all panelists and attendees, or if you want to raise your hand at the bottom, there's an icon that says raise your hand, and we can let folks have a couple minutes to talk. We only have about 10 minutes to talk per question, but would love to hear what you have to say.
Waiting the question, Anna, I can just say that I see a very dynamic world. So the Picu world is really dynamic because you can listen from all over the world that there are changing in technology, there are changing in education, there are changing in research, there are changing in our behavior. So there are a lot of things changing in the Picu.
Yep. And so let's see here. Trying to see if I can give Nicholas Monteverde wanted to chat, and it's not letting me open up the audio to you, unfortunately. Are you able to put your comments in the chat? There, you're coming on.
No, he's there.
There he is. Okay. Okay, are you able to unmute yourself, Nicholas? Because I'm trying to see if it won't let me unmute you. Darn it. Yeah, it's not letting me unmute you, unfortunately. Sorry, we thought we would be able to unmute you. Are you able to put something in the chat? And then in the meantime, we have a comment that came into the panelists talking, and my apologies if I'm not able to say your name correctly. Partha Sarathi said that finance and lack of infrastructure development is a challenge, as well as dedicated education and training programs for the physician and nursing staff, and this is in the PICUs in India. And then someone else has put in, unfortunately in Kenya, we still face challenges of the multidisciplinary approach with specialties that are involved, but are still working in silos. So they're there, but perhaps thinking about the comments of one of the last persons on that video, are we really working as a team? We can all be there, but maybe not all bringing our best care if we're not working in concert, truly as an interdisciplinary team. From Brenda, there are undoubtedly huge advances in technologies and knowledge, but hopefully our humanism remains unchanged or improves. In the world of distance telemedicine, there are opportunities in breaking down barriers between regions and disciplines, but this also brings the potential threats to personalized care of critically ill children. Someone else says we have used Zoom for our multidisciplinary meetings as hybrid PICU rounds, so a way to actually embrace the technology. When whoever said, Hani who said that, so when you used Zoom, did that mean parents who might not have been allowed to visit or other family members could join PICU rounds?
But they can speak on the microphone?
No, I'm not able to unmute anybody.
Evelyn can.
Yeah, I don't know if Evelyn's able to unmute them or not. So I'm seeing on some occasions parents were there. Were they there just on Zoom, or have parents been allowed, at least the parents been allowed to stay at the bedside during the pandemic?
On Zoom, on Zoom.
Yeah, and
yes, I like very much the one of the answer was that we have to pick the good things from the pandemic, and one is that we are much more able to use this technology like Zoom or telemedicine or whatever, or to interact more, and to also let them family get in, and for us to improve the multidisciplinary of us, because we can listen the other, and so I like this approach.
Yes, another comment in the chat, we have embraced, so it sounds like something new, a bit point of care ultrasound in clinical care and vascular access, which is a great milestone in the urban pediatric ICUs in Kenya.
Okay, Evelyn told us that he unmuted someone, but they were not speaking. So maybe they can speak directly if they know.
Yeah, and Brenda says the fact that a physiotherapist who she helped train in Cape Town is now able to present to us from her home in Uganda, Africa, to the world is testimony to a changing milieu in terms of multi-interdisciplinary care in Africa. We can do better. And then, and Hani says they've even used Zoom for handover. I think in Picu as a way to use that.
Can you hear me?
Yeah. Yes.
Oh, hi, I'm Dr. Partha. I'm from Kolkata, India. It is a nice opportunity for me to listening to all the experts and the other people who are working in the field of PICU. The most challenging thing that we are facing nowadays is that we have never been trained to practice hybrid model of PICU, where the children are sharing the space in the adult ICUs, because PICUs are being taken over for the COVID care and dedicated COVID cares. So this is a nice challenge for us to work together with the adult team, adult nurses who never had been exposed to the pediatric population. But we are very surprised to see that they are picking up things pretty fast. And I think that will be a future model in a resource limited setting to practice PICU, because dedicated PICU in most of the centers do not exist. Thank you.
Thank you for those insights. I think we need to move on to probably, Luca, don't you think, to our next set of survey questions, and then and we'll share those results again, and then go on to our second video. So whenever you're ready, Evelyn, if you can post the second set of survey questions.
So we move from change to challenge.
Sometimes they're one and the same.
Yeah.
There you go. You should now see, I think, 3 quick questions. And I'll go ahead and read a comment while you guys are completing that. Lona Mwenda says, simulation training is a powerful tool to bring the multidisciplinary PICU team together. This is one area that would need to be supported to be able to grow in low and middle income country PICUs. A challenge is how to do this safely, but also, here's a big challenge, right? Respecting infection control barriers during the COVID era.
For the low resource, I can add that a simulation can be done also with low resource. We don't need the high fidelity simulation, but also low fidelity simulation or games can really do the same work as high fidelity and be the occasion for debriefing and increase teamwork and team building. So this can be another aspect.
And we'll share the results of these questions here in just a second. Zaf says we use lots of Zoom teaching for Birmingham Children's Hospital critical care trainees. This has grown to become global. Yes, I've been definitely following that in social media, and everyone is invited. So nurses, doctors, and other allied health professionals. It's also great that in turn, they can now get speakers from many global areas, including speakers from ELMIC countries sharing experiences. And then while we're waiting for our survey results, another comment from Partha Sarathi. Any thoughts or suggestions on how best to practice the hybrid model of care for the PICU from the experts, or if anyone could share their experience? So I think that falls under the challenge category that we're kind of coming up to next. So keep that thought in mind when we get to questions after the second video.
Mm-hmm. Okay, the results.
Go ahead, Luca.
So does your Picu participate in research? Majority say yes, so 85%, and 50% no. Does your Picu lead any research project? No, the majority is, yes, 60%, and no, 40%. So majority of Picu, anche if half and half almost, have a research project. And are the team members beside involved in research? So nurses, therapists, pharmacists? A majority say yes, so 62% yes, these professions are involved, and 38% no. So this is what happened from the participant, and we have already questions from the chat. Rocho say Zaf temps are great, but the time zone difference is a problem. So it's just a message to Zaf, really.
Yeah. Great. Ready for video 2?
Yeah.
Okay.
Let's see the challenge from our colleague.
As a dietitian, our biggest challenge is to prevent malnutrition during PRCU stage by making sure that our patients are receiving their all nutritional needs, even during frequent feeding interruptions due to many medical procedures requiring the patient to be in PO.
So when I think about what lies ahead in terms of PICU practice in the 5 years or the few years ahead of us, the first thing I hope is that we don't forget the positives that we have taken away from this pandemic. Whether this relates to new collaborations, new friendships, or even new ways of practicing medicine, I really hope that we hold on to these positives going forward. But as well as this, and I'll switch gears and stop talking about COVID now, one of my greatest hopes is that we continue to see the role of the ICU nurse to evolve. Without nurses, we as ICU physicians really can't function. Many of us have learned as much from nurses as we have from our medical colleagues, from our bosses, from our textbooks. So my hope is that the role of the nurse as a practitioner and a colleague and a key member of the care team will be front and center for us all as we move into the future. The question to you, what is the biggest challenge in practice in the next 5 years? The biggest
manpower to accommodate the staffing requirements, staff retention, and clinical expertise.
More children with complex healthcare needs are requiring intensive care. Healthcare professionals should evolve together with the healthcare needs of our patients. Skilled and experienced PICU nurses play a pivotal role in enhancing patient safety and health outcomes. One of the biggest challenges is attracting new nurses specializing in PICU to join this meaningful profession and to continue to upskill and retain the current PICU nurses.
En el plano kinesiológico, en áreas clínicas pediátricas, nuestro desafío apunta a desarrollar la mayor cantidad de evidencia científica que permita exponer los buenos resultados desarrollados de forma empírica en nuestros centros de trabajo. Y además fomentar el desarrollo de nuestra especialidad en el futuro a través de residencias de formaciones con o en los centros con mayor experiencia, favoreciendo el progreso de nuestros especialistas para que sigan de esta manera aportando mediante conocimientos específicos y basados en terapia respiratoria y fisioterapia pediátrica, para de esta manera también, ¿cierto?, aportar desde nuestra área en el manejo de nuestros niños en cada una de las unidades de pacientes críticos pediátricos en nuestro país.
Biggest challenge that I see in our perspective over the next 5 years will be to ensure that the bridge between technology and actual patient care does not widen, and to maintain an optimal level of expertise within our critical care setting.
So I think coming out of COVID, and I'm hoping that is soon, but it has had some substantial negative effects, especially on parents with only, currently we're allowed to have one parent at bedside, and then there's sometimes back and forth of having two, but siblings have really been cast aside in honor of trying to protect the health. We've neglected some of the challenges of that emotional well-being, those connections and development have been impacted. And so I think it actually will take us a little while to figure out how to reintegrate in a safe manner to allow every member of the family to fully participate and be welcomed back in. And I think that there might be some fears and apprehensions that go along with that. So I think you'll be curious to kind of see how we move forward. And I think we had a lot of good things in place with family-centered care before, and some of those have had to kind of subside in differing ways, just in honor of promoting, keeping COVID at bay. So I think that will be our challenge.
The biggest challenge I see in Picu practice in the next 5 years is the full implementation of the clinical risk management as to the capacity to integrate the new normal policies in the respiratory therapist workflow, focusing not only the patient safety, but the healthcare safety will include the space expansion, adequate number of RT staff, sufficient supply of respiratory therapy equipment, and effective communication will sustain a safer, eco-friendly workplace.
The biggest challenge I see in the next 5 years in pediatric intensive care is to apply the precision medicine and to use the artificial intelligence to set up new therapeutic algorithms based on the enormous amount of data we are collecting every day in our clinical practice. This will surely open a new exciting area, a new exciting way to take care of our children.
Well, what is the biggest challenge in my PICU in the next 5 years? The first challenge only is related to the last improvement and change that we are carrying on, which is the challenge of change the practice of our PICU based on evidences and not just on what we are used to do and what we are doing so far. And this is always difficult to have everyone on board on these changes. And another challenge, which is very difficult in Italy, and it's a big challenge, is to change the nurse-patient ratio and to hire more nurses for the job. The problem is not the that the nurses are not interested in working in our unit, in our ICU, but the real problem is the money missing, and we don't have money to hire new nurses. And actually, we have a nurse-patient ratio approximately of 2 or 3. So we have 1 to 2 or 1 to 3. So we have 1 nurse for 2 or 3 patients, which is not really ideal in a pediatric intensive care unit.
In Aotearoa, New Zealand, the biggest challenge in Picu practice for the next 5 years is to address inequity and institutional racism. We must address this through prioritisation of our Māori children, Māori governance, and addressing the issues of poverty and bias. We must manage the demands of an increasing number of technology-dependent children, in addition to the general increase in patient numbers and acuity with limited resources. Our challenge is to sustain our staff enthusiasm and psychological well-being and focus on connection and our staff feeling valued, despite the chronic fatigue and dysphoria of our COVID world.
El mayor desafío que tenemos en los próximos años será el darle un impulso a la enfermería basada en la evidencia. La producción científica basada en interpretación con un enfoque reflexivo e interpretativo tendrá que estar más disponible para la toma de decisiones sobre el cuidado de cada paciente. Por medio de visible, el cuidado invisible que por años llevamos realizando, pero ahora por la globalización de la salud reclama ser evidenciado. Nuestros pacientes en las UCI requieren una atención individualizada, por lo que la enfermería basada en la evidencia constituye una pieza clave, ya que garantiza que la práctica enfermera sea efectiva y eficiente.
Obviously, having sufficiently trained PAs to staff is probably the biggest challenge I see is facing in the next 5 years.
With being ever present in our lives right now, I have no doubt in my mind that it already has changed the landscape, and how that's going to look 5 years from now is unknown. But I think what is really important is, if the restrictions are still in place for parental presence, we need to be really creative in finding ways for parents to be present and in finding ways to continue to be very family-centered.
In the next 5 years, the biggest challenge I see in my Picu practice is the increasing population and poverty. This will make the delivery of quality and affordable critical care to the needy a difficult task, especially in the absence of universal health coverage. We need to strengthen the entire healthcare setup from primary care upwards to tackle this challenge. For this, the role of healthcare professionals and the society in general will be very important in planning and increasing investment in healthcare.
Developments in technology and medicine have resulted in significant increases in survival rates in many of our Picu patient populations, whether it be the post-trauma or post-acute illness groups, or the children with chronic and complex conditions such as cerebral palsy or spinal muscular atrophy. However, as we know, alongside this increased survival comes increased morbidity. Recent research has highlighted the long-term implications of Picu admission on the physical, cognitive, emotional, and social functioning of a child, as well as the lasting effects on parents, siblings, and the family unit. I believe the biggest challenge in our Picu practice in the next 5 years will be responding to this research with action and using it to change our practice. This work has already begun in some units with the implementation of the Picu Liberation Bundle. For many units, it won't be as simple as providing education or changing protocols. A change in culture and a complete overhaul of how we do things will be required. Caring for these critically ill children has become so medicalised, and we need to peel back the layers of this and get back to basics. Additionally, it may require culture change in teams and wards across the hospital in order to optimise the care of a critically ill and medically complex child.
The challenge that I see is that I've talked about improvements in training, making specialists more available to manage children in the pediatric critical care setting, but it is not increasing significantly to manage the demand. The demand is still very big.
For example, if you have one specialist, for example, if I can give an example of neonatologists, there's currently 2 neonatologists in the whole country for a population of 40 million people. There's 2 pediatric neonatologists, well, 2 neonatologists. So even if there's a training program and they're training some few other people, there is still a big shortage in human resource to manage pediatrics or to manage children in a critical care setting. Having said that, besides those shortages, there's still a big challenge that the realization of the importance of sub or specialization is being contested with massive shortages in resources. So you find that even when if I talk about the rehabilitation setting, even when you get training to say a certain specialization just to manage children, you find that as a physiotherapist in practice, there is few of us. So you find that specialization becomes counterproductive. Like it is not possible to practice in just what you specialize because the demand is still very high. So the few human resources that we have must be stretched to see that everyone gets something.
One of the main challenges of the unit, how to enhance the environment to maintain staff resiliency and reduce work stress-related issues. We're working as a multidisciplinary approach to have a better well-being for the staff and for the environment, which has helped us as one team to overcome new challenges during the pandemic crisis.
Well, that one has certainly generated a lot of chatter in the chat. I'm trying to even get back to the beginning of them here. So some people have repeated some of the things they sent to us as panelists to panelists and attendees, but Luca, I don't know what your thoughts are, but one of the things that I'm struck by is there's both common challenges across PICUs around the world, but there are also unique challenges that PICUs in low and middle income countries have that are very different from what those in high income countries have. I heard a couple people saying bedside nurses, trying to make them feel valued as members of the team, and shortages of nurses seem to be common across regions. And some people are saying there are questions, how are you addressing that? Anybody have thoughts about that? What you're doing to address, and it might be not just nurses, but other allied healthcare professionals. And Sylvie's talking about the nursing shortages worldwide. And recognition of PICU specialization is important for career development and leadership roles. And so,
yeah, I think one of the key word is education, no, at different level. So if you educate and give different professionals in the field is the first step, and help doing this, and working in education. That is, and you have to change also the education, because maybe changing the way to educate, and you see technology can give an help in this and spread the education more than now. So as you see, change and challenge are overlapping. I mean, our world is so dynamic, so changing, and the change are also the challenge. and I see that many of the challenge are also the change. So and maybe is also the our resource. So why we are dynamic, I remember during the African webinar last day, no, 2 days ago, we saw the nurse of Africa doing a great job, and also with low resource. So I think this is is the challenge for, especially for, but not only for low income country. I think for all of us, because we are facing with cost and improving demand. Now, one of the other question is that the demand is always growing. And so we have to, with resilience, we have to face and try the way to use better our resource before improving.
Yeah, and Anne Sylvie made a comment, not just as you started talking education and making room for nursing leadership. And I would add to that, making room for leadership for all of the other allied health professions in pediatric intensive care. That's been a big sort of initiative within WIFPICS. And for me, it's really important that that's been more than just words, you know. So obviously we've had a vice president for nursing for a while, but, you know, really excited to share for those of you that may not know, as you heard Dr. Brenda Morrow in the intro video, who is our president-elect. She's a physiotherapist. And so as she ascends to the presidency in the next term, she'll actually be our first non-physician president of WIFPICS. So we have to locally, regionally, and globally, not just talk about interdisciplinary care and that we need all of the team to be leaders, is we actually have to translate that to actions and behaviors and bring people who have important skills and leadership into places where they can help influence the future care of pediatric ICU.
Yes. And Anne Sylvie confirm this view, yeah. And Nancy is underlined more strong. Empowerment is our keyword, right?
Mm-hmm. A couple people made comments along the lines of challenges in Kenya is the specific comment I'm looking at, but I believe there were comments like this from other areas, is managing critically ill children because there really aren't PICUs outside of big cities such as Nairobi. And there's a lack of a national infrastructure. And so how can we be more innovative in reaching those areas? And I have occasionally helped in managing children remotely on teleconference calls. And that was the first thing that came to my mind, was in this year of technology, where we've had to switch so much of our work and maybe even personal lives to online. Is there a way to better leverage telehealth, understanding that itself is a resource that might not readily be available outside of the big cities, but kind of like tele-ICU, tele-pediatric ICU is a way to provide better PICU services outside of the big cities. Have anyone else had experience doing that? If you want to raise your hand, we'll try and see if we can get you audio. If you want to talk about being able to do that.
It's much better if the people can speak directly.
That have done some of the tele-pediatric ICU. Anybody? Okay, Anne Sylvie. Can you give her audio, Evelyn, please? Okay, Anne Sylvie, you should be able to talk.
Can you hear me?
Yes.
Yes.
Okay. I couldn't really work out how to do this. Well, thank you very much for this, for the organization of this presentation, first of all. So really well done. It's really interesting. I just wanted to make a point, a comment. I mean, you know, there is a lot of, you know, nursing shortage is a huge problem. It's even more a problem in low-income countries. And, you know, we talked about, you know, you just said empowerment. And I think, you know, the best person to actually help support the whole system is our medical colleagues supporting the, you know, the nurses and allied health workers locally, because they are the ones who have the power to make changes at local level. So I think it needs to be like a teamwork, really, to be able for everybody to be able to work at the, you know, the full scope of practice, and to help, you know, people to develop new initiatives like new education programs or collaboration with other countries. And yeah, that's I really wanted to say.
Thank you. I am looking at some, trying to look for some of these other comments, especially the ones that might have come to just us and that everybody didn't see them. So here's one from Nicholas Monteverde, coming out of the Latin American region. Our objective is to stimulate the implementation of quality improvement initiatives in our Picu and in the region. We believe that it is an important preliminary step to project ourselves to lead or participate in future randomized controlled studies that are capable then of generating better quality evidence. And so, Nicholas, are you saying that your ability to do important local quality improvement projects is a way to help build your local structures to be able to then participate in larger trials? Is that part of the goal? We'll see if he has a chance to.
Is mute. Seems to be mute, the microphone.
Yeah, can you unmute Nicholas, please, Evelyn?
Nicholas, sorry, I can't speak now. Un po'.
Yeah, I don't
speak. You can speak.
Yeah. Oh, he can't speak right now.
You can speak, yeah.
So I don't know if you mean you can or cannot.
I think he can't.
Oh, okay, no problem. What else?
Maybe we can.
So Kenya has started training PICU specialists. I was thinking maybe one last comment before we go on. So my question in my mind when I saw that is, when you say PICU specialists, is that just mean physician specialists, or is that training for other disciplines, nurses and other therapists? What does the term PICU specialist mean there?
Can you hear me?
Yeah.
Yes, we can. Go ahead.
I'm Partha again. It's just that looking at the comments and the discussions that our colleagues across the globe are facing, that retaining the trained workforce. When we did a survey in our unit and the nursing staff want to move on, and amongst the various causes they have cited, the most important thing they found is that they cannot take the stress of looking after the child who is dying. And many of them have quoted that if there was a better way of handling the stress associated with looking after a very sick child in the unit, possibly they could have considered. But unfortunately, in many areas, the psychological well-being of our colleagues is often neglected. we thought that if we could address that issue a bit better, and that is a more of a hand-holding exercise, possibly that would help them cope with the stress and continue to work for the children. That is just a thought.
Yeah, it's not something that necessarily is intuitive or that we're built into. How do we manage that stress? And it accumulates over time, right? Every day, different crisis, losses, challenges, and we need to be able to provide support for people to be able to work through those in order for us to stay mentally healthy to continue the work. I think that's a challenge everywhere. It certainly is in the United States as well. And
in Italy too.
Yeah, I imagine that's everywhere, but we're going to move on to, Evelyn, if you will, the final set of survey questions. And in the meantime, I'll make sure everybody, Dr. Sapna Kuchadkar put into the chat to our panelists to encourage all of us in the Interprofessional Peds ICU to engage on social media, on Twitter or even the other forums. But particularly on Twitter, we have more than 1,200 Picu colleagues from all professions around the world. And we actually have a Picu list. Sapna, are you able to put that in again, addressing it to all panelists and attendees? Because it came to just all panelists, so that link can't be seen by everybody else. And because it helps us connect globally, it's a place you can put out questions, get prompt feedback from people around the world, share experiences, encourage each other. People recruit for studies and enhance their enrollment in studies. And there's actually a Picu list that you can actually look at for people from around the world. And we're ready for that third survey whenever you are, Evelyn. And there are, I think, 4 or 5 questions here. So just make sure you scroll down and answer all of them, please. As you can see, the focus on this last section is on family in the pediatric ICU.
Yeah. We are speaking about human research, and family is going to be a human research we can use.
As we give people time to finish these questions, and there's already comments about pets as an interesting thought. Struggling with infection control issues. Yes, indeedy, but they are some of the best therapy out there. So that'll be a fun conversation. So there's our final poll results. and remember the first question asked about outside of COVID restrictions, when are families allowed in your Picu? Anytime was the response of 65% of you. Only during the daytime, 13%. Just certain specific visiting times, 20%, and 3% said families are not allowed in the Picu. How many people are allowed at a patient's bedside? Realize there might be different answers, but we just kind of had to select a few. The 53% of you said just one person's allowed. 40% said 2. Nobody selected 4, but 8% said there's no limit. Third question, who is allowed at the bedside? And you could select all that applied. Parents only was 58%. Parents plus other relatives was 50%. Our non-relatives, so friends of the patient or family allowed at the bedside, 30% said yes, 15% said no, and 55% sometimes, so it's situational. And last but not least, our family pets allowed at the bedside, and only 3% said yes. Now, there's a different question that we didn't include, is it whether you have like therapy, pet program, animal program at the hospital. That's probably might have gotten a different answer. So with that, let's listen to our final video.
Generally, I think that from my experience, I've seen that involvement of family has the biggest effect on reducing or fastening the process of discharge for children from the intensive care unit. As a rehab professional, I've seen that, first of all, for us, it is pertinent that the family is involved for purposes of continuity. So if you say that you're going to do certain exercises or certain positioning techniques for this child in the intensive care unit, and then the plan is to discharge them to the ward and then eventually home. Because of our resource constraints already, you may find that the care reduces as they go further down, or they may not, if they are lucky to get it in the intensive care unit, you don't know if they'll be able to get the same care on the ward, and if they will get it at home. So teaching the parents then ensures, teaching the parents or the family how to manage the child, the simple therapeutic techniques, then ensures that the child gets the intervention they need, whether or not the therapist is around. So I can't even stress enough how, for us, family is part of the management of children in critical care settings.
Well, I think the family has the role to bring the voice, the videos, the cuddles, the music of family at the bedside. And I think this is the best neuroprotective strategy we can prescribe to our children. It's the best way to protect their brain in the long term.
So believe that the role of family starts much before the child comes to Picu. Seeking early medical attention in the course of illness is of utmost importance in improving the outcome of the child. With improving literacy rates in low and middle income countries, caregivers are now more informed about the condition of the child. So it is important to establish a good communication with them and involve them in the decision making from the start. In resource limited countries like ours, the nurse to patient ratios are not ideal, and parents may play an important part in the bedside care of the child. Finally, with improving survivals, some children may require continuation of care at home, where the family needs to transition into primary caregivers with appropriate training. Thus, The family plays a major role in the care of child before, during, and even after the pico.
Cuando ingresa un niño en estado crítico, indudablemente también ingresa una familia completa a la unidad, con problemas no físicos, pero sí a nivel psicológico y social, por lo que la familia se constituye en un sujeto de cuidado en la UCI pediátrica. Se puede observar que las necesidades de la familia del niño en estado crítico son de mantener el contacto físico, la interacción, la comunicación asertiva, y en la medida que estas necesidades sean satisfechas, la familia se equilibra y puede ser de gran ayuda para recuperar a este ser humano. El amor es el que alivia, calma, ayuda y rehabilita, por lo que el papel de la familia es fundamental dentro de las unidades de cuidado intensivo pediátrico. Gracias.
Can't any longer talk about care without this family. And for me, and hopefully for all of you, the family is a core member of the multidisciplinary team. There's plenty of evidence in all ICU settings that family presence during rounds, participation of the family in the care of their child, is a great satisfier not only for them, but for all of us as a medical and clinical team, and obviously for their child. And really that participation, that membership as a team and function as a colleague is something we really need to foster and to promote going forward.
Whilst we may be the experts in medicine or therapy, the family is the expert in their child or our patient. And it is only by working together as a team that we can improve outcomes. When a patient is admitted to the intensive care unit, we ask the family about them, their medical and social history, their likes and dislikes, and so forth. This gives us the opportunity to paint a picture of what we think might be going on and what outcomes we're aiming for. On the other hand, the family are scared and vulnerable. They don't know what to expect or what may happen day to day in the future. Most families won't have been in this situation before or have another admission to compare it to. Due to this lack of knowledge and expectation, it's hard for the family to advocate to improve the outcomes for their child. In Australia, there is currently work being done to create a Picu website with the goal of providing patients and families with age-appropriate information of what to expect during their Picu stay and in their life after Picu.
And family involvement is essential to improving PIC outcomes of children. It's important to involve family members in care as well as decision-making whilst children are in ICU, which will hopefully improve their long-term outcome.
Family support is very important to improve the PICU outcomes, especially the mother. She can come to visit the baby and hold him if it's possible, and by providing breast.
Sort of like some quiet and subtle ways that I ask them to tell stories about who they are and how their family functions. And sort of one highlight moment came out of a big challenge where we couldn't have the siblings in last summer due to some of the COVID precautions. So we managed to bring the ICU patient outside and did a little ceremony and celebration of their life before they left this world. And my preparation for the siblings was involved when I walked them around the hospital and I talked about, tell me what you love about your brother. Tell me what kinds of things, what do you believe about life and about death, and what are you expecting to happen? And they gave me these beautiful golden nuggets and memories of who he was. And so I walked away from that scenario just recognizing the importance of individualizing their care and allowing the siblings to participate even if it's a non-conventional way. And so just becoming creative and like keeping them safe, but still very involved. I experience and hear a lot of the parents' fear and helping them to be able to, even in the face of fear, to be able to still parent and have a role, and the importance of them being present and supported the whole time.
Partnering with the family serves as a bridge between patient and the team. One of the best witness practices in our Picu is the open, honest, clear communication between the family and healthcare team. Thus, family empowerment as the decision-making and the confidence in in the delivery of childcare plays a vital role in improving Picu outcomes.
The families are the front line for their children at their homes. They do 24/7. It's being done in the hospital. I myself have what I like to say is a mini ICU in my home. We do it all here. In the hospital, unfortunately, the healthcare providers there don't get to see Nikki when she's at her happiest. They don't get to see children outside of their illness. And I bring that perspective to the table. I also bring the perspective of the 24/7 care and the meetings with all of the other team members to the table. It's all up here. And that knowledge and wisdom and insight, it can be extremely valuable to the team members.
Una de las pruebas más complejas que una unidad de cuidados pediátricos tiene que abordar es el sufrimiento del paciente y de la familia que lo acompaña. La integración de la familia en el cuidado del paciente y la comunicación eficaz con el equipo interdisciplinario que compone la unidad de atención aumenta la satisfacción del grupo familiar, incidiendo directamente en la percepción de la calidad de atención, ayudando a la recuperación del paciente, en el control del dolor y ansiedad y aumentando la adherencia al tratamiento. La verdad es que de esta forma, al integrar las familias, se fomenta la humanización de los cuidados en pediatría, viendo al niño de una manera holística y no solo de una enfermedad, a lo que hay que intervenir. Y de esta forma, el paciente y sus familias afrontan de mejor forma el proceso.
It's very interesting because I just had an experience abroad as a fellow, and I could compare the family role in both countries. I was in UK, and what I can see and what we need to improve also probably outside this pandemic, this COVID pandemic, is trying involving more families in the care of the patient 24/7, probably in our unit, which is not easy so far. The families can stay only during the day and the afternoon, also for the COVID-19 situation. And also we would like to involve, or I would like to involve more families in patient care, like, for example, to teach them how to do physio and to involve them in the physio, also in order to stimulate early mobilization. So I think that can include the family in the healing process of the patients.
That continued reminder of that developmentally appropriate way and that compassionate care make the difference in feeling and outcomes. And for that family, they'll always remember that one of the first people she talked to was me when she could finally use her voice. And so I still get follow up with her from time to time, and she speaks positively of her CCCU journey and the way that everyone took really good care of her and cared about the wholeness of who she was, not just her medical needs.
Our whānau families have a pivotal role to play in improving Picu outcomes. We need a greater patient and whānau voice. And in Aotearoa, New Zealand, we need to hear in particular from our Māori and Pacifica whānau about how to address institutional barriers, to work with them as equal partners and effectively meet their needs and those of their children. We need to engage our whānau more fully as active participants in the children's care and to truly value their views. He aha te mea nui o te ao. He tangata, he tangata, he tangata. What is the most important thing in the world? It is the people. It is the people. It is the people.
Hello, my name is Anne.
So that's the end of our final video, and there was clearly a lively chat going on about the roles, opportunities for families in our pediatric ICUs around the world. You know, whether it's how often you let them in your ICU, what role can they have? Somebody posted something about maybe we should have asked the question, do you allow families at the bedside during a resuscitation? That's certainly a challenging topic, and there's probably not one right answer to that. It's going to be local, cultural, also based on the preferences of the family, the ability to have somebody there to support them during that time. And I was trying to say, someone here sent something just to the panelists I wanted to read. And I tried to copy it, but I couldn't. So from Lona Mwenda, family presence and engagement is extremely important for the move towards Picu liberation, mobilization, etc. It also requires the Picu health workers, nurses, physicians, and other allied workers to believe in its importance. Sometimes a mindset shift is needed to challenge local policy. It's a work in progress. And Sylvie said, whatever the socioeconomic and education of the family, we should aim for family empowerment. For family empowerment, we need family to be present, participate, and engage.
Yes, I think it's really a cultural change that and Picu is one of the structure that can push on this cultural change. In every country you are. I mean, I think we have the gene for this cultural change.
Yeah, I think the early mobilization, remember, early mobilization can be something as simple as allowing a family to hold an intubated infant. Early mobilization isn't just walking a patient down the hall. And that's probably that effort of, you know, getting an infant out of bed and being held is probably just as therapeutic for the family as it is the child. In terms of the pets, I saw also a number of comments. Satoshi said they just started a dog therapy program in Tokyo. Some people say they make, in terms of personal pets, exceptions for certified therapy or emotional support animals. Otherwise, the only pets allowed are through the pet therapy program. At a hospital I worked in many years in Ohio here in the United States, we'd long had a dog therapy program, but we actually also had a pony, yes, a real live pony that was a part of that actually wandered the halls of the hospital, believe it or not. And the kids loved it. In terms of allowing parents to be around during CPR, that is really a kind of a topic unto itself. Anybody want to speak to that in our last couple minutes here? Raise your hand and we'll give you. Evelyn, can you please give Janet Matson? There we go, Mike.
Yes,
there
hello. Thank
Hi.
you. Hi, I'm from Sweden, the PICU in Stockholm, and we just finished a small study about how nurses and physicians felt about having patients' parents during CPR. And some of them, the more experienced ones, thinks it's totally normal. It should be like that, because if it's not going well, the family should be there at the last life of their child. But some of them don't feel comfortable performing with the parents in the
I think we just lost her audio.
Comfortable. If you're not comfortable, you should be educated a bit more and be accompanied by someone that is more experienced, that can be your guide, because you are not allowed to let the parents go outside the room, because they are needed with their child. When we transport children with airplane or in ambulance, even if they are critically critically ill, so we fear they might die during transport, we always bring at least one of the parents, and that's never a problem. Thank you.
Thank you. Well, I think we are out of time. We want to respect what the time we had for everybody. When I want to wrap, as Luca and I wrap up, and I'll let him give some concluding statements, I want to start by saying thank you again to all of the committee members from the various regions. It was really your work that brought this to fruition this week. Luca and I were just trying to kind of keep a timeline and be supportive, but we would really be remiss if we didn't thank, you've heard me talk to Evelyn, who's kind of hiding behind the WIFPICS label today. So Evelyn Zuberbuehler, who is one of the secretariats for WIFPICS, has done a tremendous amount of work behind the scenes, along with Daphne and some other folks, pulling these together, building videos from all of these recordings that were sent by individuals from around the world and putting them together into these videos that you saw this week, because people were doing it in the places they were with the resources that they had, because it wasn't feasible to bring them together at one point in time. And this would not have been possible without her. It's the middle of the night for her right now, and she's been doing that much of the week. And I just want to make sure that we say thank you.
Yeah, I want to join all these thanks, but I want to thank also all the participants. I mean, all the people that did the interview, that they did the presentation. It's really amazing how, I mean, Fiona say people is the power, and really during this week, people had the power and of sharing, of listening, and I think this is the big word. So it's really, I learned a lot in this week. So I have to thank the people that say to do this this big week, and seems a long time ago when they decide. And this year that was strange because it was the year of pandemic. There was all this stuff going. Instead, with Zoom, we did all this work. It was really amazing. So I have to thank everybody.
Yep, and we're looking forward to World Picu 2022. Watch for it. Oh, the last thing I'll say is all of the recordings from this week, including today's, will be posted on the WIFPICS website. So if you missed any of them, you don't have to miss it. Go there and you can watch them all. Thanks, everyone.
Okay, thank you. Bye-bye. I will come again on the space station.